So a very good afternoon. And on behalf of Chandigarh Ophthalmological Society, I welcome you all to the 33rd annual conference. I would like to express my sincere gratitude to our chief guest for the day, Professor Jagatram, Director PGI Chandigarh, for sparing time from his busy schedule to be with us here today. Thank you, sir. I also welcome our guest of honor, Professor M.R. Dogra, who's currently the Director of the Retina Services at the Grewal Eye Institute in Chandigarh, and he's our former head of the department at the Advanced Eye Center, PGI. Professor Emeritus, Professor Amod Gupta, a mentor and guiding light to ophthalmologists, I think not only in the region, but all over the country. Our current chief of the Advanced Eye Center, Professor S.S. Pandav, also the current president of the Glaucoma Society of India. And all executive members, I thank you for being here. I would hope that everybody enjoys this scientific program and tell you a little bit more about it. I invite Dr. Jasprit Sukhija, President, to say a few words.
Thank you, Dr. Chintan. And what better could I have thought for? Very fortunate to be there in front of my teachers, respected teachers who have guided me here. And I'm very fortunate. And a warm welcome to our chief guest, Professor Jagatram, Professor Amod Gupta, who was a visionary and where we are in this eye center is because of him. And thank you very much, sir. And a warm welcome to Professor Dogra, who's our guest of honor, and our HOD, Professor Pandav, and respected colleagues and dear friends. Welcome to this 33rd annual conference of Chandigarh Ophthalmologic Society. And before we proceed, we'd just like to take a few moments to pay tributes and homage to Dr. R. Kumar, whom we lost recently due to COVID on 30th May this year. And of course, he was an active member of the Chandigarh Ophthalmologic Society, and he graduated from Medical College in 1968 and MS from PGI in 1971. He was an alumni here. And of course, he started his private practice in 1973. So he worked tirelessly, even when he was doing private practice, all his efforts were put in for the promotion of ethical and affordable healthcare for improvement of health services in the region. He was very passionate about writing and regularly contributed articles to newspapers and other print media, which we would often read. And he was in every meeting of Chandigarh Ophthalmologic Society. He was always there to guide the society, even if there are elections, the meetings, and you could just ask him anywhere the history of Chandigarh Ophthalmologic Society. So we would just look upon him to just know and guide us how we go ahead. And but we are very unfortunate to have lost him at this age and because of COVID, and we'll definitely miss him. So I just request all of our members to observe silence for 2 minutes, and then we'll start the conference. So we've got a great academic feast here with probably every session, every subspecialty of ophthalmology being covered. And we have eminent speakers here, as you've seen the scientific program. We have competitive papers, challenging cases, and a quiz, basically, which will help us. Probably the residents would be much more interested in that. So it's a kind of a mixture of everything what we've had. And I hope you all enjoy this program, sitting at home, sipping a cup of coffee. Thank you, and I'll request Chintan to now take over.
Thank you, Dr. Jasprit. We surely will miss Dr. Ramkumar, and I'm sure he will be the guiding light for us always. It's now my proud privilege to introduce our chief guest for the day, Professor Jagatram. So Padma Shri Professor Jagatram is the director of the Postgraduate Institute of Medical Education and Research, Chandigarh. He was the former head of the Department of Advanced Eye Center in PGI. He's on the board of governors of the National Medical Council since 2018, and apart from shouldering the responsibilities of PGI Chandigarh, he also has the additional charge of Director AIMS Raebareli, Bhatinda, as well as Bilaspur. Sir is a surgeon par excellence with over 90,000 cataract surgeries over a period of 40 years since the time he's been in PGI, out of which more than close to 10,000 are surgeries in pediatric patients. He has won more than 24 national and international awards. Most of them are in the best categories. He's delivered close to 450 lectures on pediatric and age-related cataracts. And not only is he a great surgeon, but also an avid researcher. And he's published close to 300 research publications in peer-reviewed journals of extreme repute, including Lancet and the New England Journal of Medicine. So without taking much time, I think I would now invite Professor Jagatram to please guide us with his words of wisdom and share his thoughts.
Thank you, Dr. Chintan. Good afternoon, everyone. Our respected Professor Amod Gupta, Professor Emeritus, Advanced Eye Center, PGI. He is our teacher, mentor, and visionary. Guest of honor and our dear friend, Professor M.R. Dogra, Professor S.S. Pandav, current head Department of Advanced Eye Center, PGI. We have with us Dr. Amit Gupta, Dr. Ashok Sharma, Dr. Sandeep Jain, Dr. Rakesh Gupta, Dr. Joram has also joined us. Professor Suresh Kumar, Head Department of GMCH, Sector 32, Chandigarh. Dr. Jaspreet Sikhuja, President, Chandigarh Ophthalmological Society. Dr. Chintan Malhotra, Secretary, Chandigarh Ophthalmological Society. Office bearers, members of Chandigarh Ophthalmological Society, and dear friends and colleagues who have joined virtually. It gives me great pleasure to connect with you virtually on the occasion of the 33rd Annual Conference of Chandigarh Ophthalmological Society. The past year has been a tough one for all of us. COVID-19 has changed the way we have known life, not just professionally, but personally. Many of us have suffered irreparable loss. The loss of our senior colleagues and member of Chandigarh Ophthalmological Society, Dr. R. Kumar, who always guided the society in the right direction, has come as a big irreparable loss to the family and all of us. Martin Luther King once said, "The ultimate measure of a man is not where he stands in the moment of comfort and convenience, but where he stands at the time of challenge and controversy." At every stage of life, we will have two options. One of the maintaining status quo and letting things happen as they are. Other of the taking up the challenge posed and doing something different. The second option often lead to the ladder of progress and make one's life worthwhile. Under the leadership of Dr. Jaspreet and Dr. Chintan, and with the guidance and mentoring of our senior teachers like Professor Amod Gupta, our senior member, Professor Dheer, Dr. Bhajan Singh, Dr. K.L. Pasi from Chandigarh Ophthalmological Society, has managed to stand strong in the testing time. The regular education initiative covering the various subspecialties of ophthalmology under the banner of Chandigarh Ophthalmological Society over the past year has kept everyone engaged and informed about the latest in ophthalmology. The Chandigarh Ophthalmological Society newsletter initiative has been instrumental in bringing out important educational snippets as well as showcasing the extracurricular talent of COS members. This first ever virtual 2 days annual meeting would be the perfect way to top off what can only be described as the most challenging year of our lifetime. There are a couple of thoughts I would like to share with all of you on this occasion. The first one is on the teamwork. If anything, COVID has taught us, it is the importance of teamwork and helping each other. Having led PGIMER Chandigarh as director during the COVID-19 pandemic, I have dealt with the challenges and the conflict every step of the way. But the work of a team leader is to create environment that is conducive to the ideas of the young while respecting the experience of the old. It never hurt to be an encourager. The world has enough critics already. It is the coordination of the young and the senior that helps PGI take on this mammoth task and set the system in place at a short notice to deal with such a massive pandemic. It is important to implement the same strategy at our departmental level as well. Fighting solves no problem. It only creates new ones. Michael Jordan has rightly said, talent wins game, but the teamwork and intelligence wins the championship. Individual goals of what one wants to be in life are also important, but it is equally important to align those goals with the best interest of the organization and institution where we work. Second, a lot of us, especially in the public sector hospital, have gotten used to doing comparatively less work. A lot of us have started hiding behind the curtain of social distancing and avoiding crowding to justify seeing less patients. While following the COVID appropriate behavior is paramount importance, but being available for your patient is also equally important. Patient comes to us in distress. Nobody walks into the hospital out of fun. Mahatma Gandhi once said, a customer is the most important visitor on our premises. He is not dependent on us. We are dependent on him. He is not an interruption to our work. He is the purpose of it. He is not an outsider of our business. He is part of it. We are not doing him a favor by serving him. He is doing us a favor by giving us opportunity to serve him. A good teacher, a good doctor is judged by the 3 A's: availability, affability, and ability, in the same order. Availability is one of the most important. You may be the best surgeon in the world, but if you are not available when your patient requires you, what good does it do to them? Personal attention and listening to your patient calmly solve half of the illness of the patient. Affability means being likable. A clinical doctor need to make the extra effort to make his patient feel comfortable. Put himself in the shoes before making a judgment. Affability means being human and treating your patient the same way you would expect to be treated if you walk into doctor's office. Ability is less important than the other two. One can become able with practice and experience, but it is difficult to teach a person empathy. Hippocrates had rightly stated, care sometimes, treat often, and comfort always. The way forward as a society for Chandigarh Ophthalmological Society is a challenging one. Members are strength of any society, and the society need to show its value to add more members. Academic is one way to go. The society should try and ensure participation from all academically inclined members in its academic program. Even stand-alone practitioner should be encouraged and invited to present their cases so that everyone can learn from each other. I sometimes see more useful discussion happening on the WhatsApp group than on the society podium. Standing up for the issue that concern the members and finding solution to them is another way. Alone we are a drop, but together we are an ocean. We can bring about great change if we deliberate on the issue and work together on them. Once again, I would like to congratulate the organizing team from the Advanced Eye Center, PGI Chandigarh, and the COS executive for putting up this great show despite enormous challenges posed by the circumstances that is COVID-19 pandemic. I hope all of us will have a great academic feast over the next 2 days. Thank you very much. Jai Hind.
Thank you very much, sir, for your words of wisdom, and I'm sure we'll try to follow all of them. I would also like to request our guest of honor, Dr. M.R. Dogra, who's the Director Retina Services at Grewal Institute, the former head of the Department Advanced Eye Center, a founder member of the IROP Society, and a member National Task Force on ROP. These are just some of his achievements, and I think the biggest achievement is the passion sir has for children and what he's infused in all the people passing out from the retina services here. I would request sir to say a few words and then to please declare the conference open.
Thank you, Dr. Jaspreet and Dr. Chintan, for inviting me over here. Respected Professor Amod Gupta, our mentor, Professor Jagat Ram, Director PGI, all my friends over here, as well as Dr. Pandav, the present head of the department. I stand before you here being a part of the Advanced Eye Center or the Department of Ophthalmology, where we all grew, we all learned. And in fact, we learned a lot of values from our teacher, especially Professor I.S. Jain. We remember for many things, I mean, including how we today behave, how punctual we are, and how much academic oriented we are. And of course, subsequently, Professor Amod Gupta, who proved that who was his most worthy probably student and carried not only the legacy, and that's what we need we need to lead by the example, and he led more than anybody could. And we've been fortunate to have a director from our department, and that is Professor Jagat Ram. Finally, that wish was also fulfilled. And to the COS, I would say I think if we have, I remember when I was trying to push Chintan to be secretary, and she was reluctant. I said, I think you have to take up these kind of things. And yesterday I was telling that maybe you are the next Dr. Namrata. Look at Namrata. I mean, she's phenomenal. She's organized such a huge national conference. So, and of course, I think they have done a wonderful job with the guidance of Dr. Jaspreet being there. They've been very, very hardworking and concentrating on it. And the program has come out very well. And I'm sure it's going to be a great learning feast. And I'll not take more time. I think Professor Jagat has already given us certain tips that how we should be doing, what we should be doing. And with this, I again thank both Dr. Jaspreet and Dr. Chintan. And thank you very much for inviting me here.
Dr. Chintan, unmute, please. Dr. Chintan, unmute.
Thank you very much, sir, for that. And may I request Professor Pandav to say a few words also, please?
Thank you, Dr. Chintan and Dr. Jaspreet for organizing this wonderful conference. I think because of the COVID, we have adopted two new paradigms, and I think this is one of them. Apart from our regular teaching, I think we have now online conferences as well. And my regards to all our, the dignitaries who are here today. Professor Amod Gupta, our mentor. Thank you, sir, for joining us, and also Professor Jagatram, Director PGI. I think we always meet him, and it is always a kind of pleasure, to listen to him. And I think you just had a glimpse of his thoughts this afternoon. I think very valuable talk, basically, in how we should be doing in post-COVID era. And some of the concerns he has raised are very real ones and very genuine ones when we come back to our full-fledged clinical workup. And Professor Dogra, of course, he's always there. Whenever I have a little problem, I always call him. So thank you very much for joining us this afternoon. And I'll welcome on behalf of Advanced Eye Center and also being part of the COS, I welcome you all to this conference. And I'm sure you're going to have a great academic feast. And with that, I again congratulate Dr. Jaspreet, Dr. Chintan and their team for doing this great work. And thank you very much for this opportunity for me to be associated with this program. And with that, I hand over to Dr. Chintan. Thank you.
Thank you, sir. And with all those great speech talks and the pearls of wisdom by all our teachers, I think we'll set an example and finish this inauguration on time so that we can just start the next session. We have very interesting cases. On Hall 1, we have the uveitis session where there's the keynote lecture by Professor Amod Gupta, which is important for all young researchers as to why should I publish. And in Hall 2, we have the young ophthalmologists who will be presenting their challenging cases. So I would request everybody to please log out of this session, except for the people who are in the next session. They can remain. And we can log out of this session and log in to any of the other halls to listen to what the sessions are going on. Thank you very much. And thank you for sparing the time.